Hello there, Pattaya. It's Dr. Ian, and today I'm going to tell you something about the Diabetes and Endocrine Centre. This is a new centre for the hospital, and in fact is the only centre of its type on the eastern seaboard with 3 endocrinologists. Now, what is an endocrinologist? It's a very, very specialised form of medicine with very specialised doctors. Endocrinology is a very difficult subject to get your head around, but that's why we have specialists in the field. Let's go and meet our specialists in the centre. Let me introduce you to the first of our endocrinologists. This is Dr. Priyaporn. Welcome to the program, Dr. Priyaporn. Now, how long have you been an endocrinologist?
I just finished fellowship in Chulalongkorn University for about 4 months, but I have experience about endocrinology for 2 years.
And you've done a fellowship in endocrinology?
Yes, in Chulalongkorn University.
That's very good. To do a fellowship, you've gone further than just the basics or the next step up. You've gone to the top. Now, endocrinology I always found a rather difficult subject because there are 8 endocrine glands and they all affect each other, which means that when you start doing something with one endocrine gland, this may produce the wrong effect on that endocrine gland. So, since there are 8 endocrine glands, I'll let you pick 3 and we'll talk a little bit about those. So which gland would you like to talk about first?
First is pancreas, because now the people have problem about energy and metabolism. Like we hear that diabetic is the major problem in the world. Like that, Thai people have problem about diabetes. Now, because from lifestyle that change to the modern lifestyle, then the people have a little time to exercise, have not shoot the good food for the body, then produce to abnormal in energy and metabolism.
Of course, Thai people from some parts of Thailand eat that awful stuff called pra, which the fermented fish from Isan, which smells horrible. And how they can eat it, I don't know.
I can read เดี๋ยวนะแป๊บนึงนะคะ what question that you ask?
Yes, but para, I think, affects the pancreas. They get cancer of the head of the pancreas.
Maybe, and para is make the cancer of hepatocellular bile duct. Bile duct, it is part of hepatocellular cancer.
So, don't eat it. It smells terrible and it's not good for you. So, let's carry on a little bit about, as you were saying, diabetes is the number 1 disease in the world.
I think maybe number 1, about nearly 300 million people may have diabetes in about 2025.
So how do you examine or diagnose people who've got a problem with diabetes?
Okay, diabetes is the problem about abnormal energy and metabolism that have the mainly 2 types of diabetes. Type 1 is which our pancreas cannot produce insulin that make the glucose or carbohydrate to the energy. This is type 1. That the patient may typically require insulin injection every day. And type 2 is the pancreas is make the insulin but produce insulin but not enough for change the glucose to the energy.
So is diabetes mainly a lifestyle problem?
Yes. Now maybe from lifestyle problem, many people have obese and no more time to exercise. Not take the good food, low fiber.
Is it a disease of people who are growing older, or is it of the young?
Again, please.
The disease diabetes, do you see it more in the older people or in the young people?
In the past, I see in the older people, but now maybe become younger.
Right. So, can you do something about it? When you've diagnosed somebody with diabetes, do you have treatment for them?
Yes. Principle of treatment diabetes is to education patient about the goal and the disease. The goal of treatment diabetes is control blood glucose, control blood pressure, control body weight, and control cholesterol in the normal range. If we can control it, we can delay the complication of diabetes. And then the patient may have good quality of life.
Of course, quality of life is something that I speak about very often, because I honestly believe that if you haven't got quality of life, you've got a real problem. Whereas if you do something for yourself and can counteract problems that you may have and get a better quality of life, then you've done a wonderful job for yourself. Okay, that was a brief thing on diabetes. What other organs would you like to do?
I think pituitary gland.
Pituitary gland. Where is the pituitary gland?
Again, please.
Where is the pituitary gland in the body?
Is in the base of skull, nearly the optic nerve. Pituitary gland is about 1 centimeter in the base of skull. That this gland is produce special hormone like sex hormone, growth hormone, thyroid stimulating hormone to stimulate thyroid gland. And another one is prolactin. About the last one is steroid hormone to stimulate adrenal gland to produce cortisol.
So this tiny little gland, the pituitary, has an effect on the thyroid, on adrenal glands,
and prolactin to produce milk for the baby, and sex organ.
And it's about that size, and that's all. So how do you diagnose a pituitary problem?
The patient may have problem about eye problem. They may have the low visual field, or some patients have headache. Some patients have symptom of hormone deficiency. If the patient have this symptom, we can find out the cause of them. Some cause may be from pituitary gland, but some cause may be from another.
So you can see the diagnostic problems that occur with endocrine glands. Here is the pituitary, this tiny little gland at the base of the skull, sort of up in there, the base of the skull, and the presenting symptom might be a decrease in vision because the little gland is so close to the optic nerve that it causes a visual problem. And the patient would normally say, oh, my vision's going, I've got a problem, and go to see the eye specialist. But in actual fact, the patient needed to see the endocrinologist. All right. Well, give me one more organ.
One more organ.
You're cheating.
Okay, I think adrenal gland. Okay. Adrenal gland is the gland that's above both kidney. It is about 3 centimeter and thick is 1 centimeter. It is produce steroid hormone like cortisol and epinephrine, norepinephrine. It is a vital hormone for that make we can stay off life and control blood pressure.
So once again, we have fairly small organs, small glands, but they have such a far-reaching effect on other parts of the human body. If I remember rightly, Addison's disease was...
Addison's disease is one of the diseases of adrenal gland. It means that adrenal deficiency cannot produce steroid hormone. If the patient have that symptom, may have postural hypotension, feeling fatigue or no power, feeling general life fatigue.
I think that for a lot of the endocrine glands, fatigue is a presenting symptom. So if you feel that you just haven't got the energy that you think you should have, maybe it's an idea to come along and see some of our doctors and see whether or not there is a problem with the endocrine system. Would you agree, doctor?
Yes, I very agree. Because when patients have fatigue, they may have some treatment that not point to the cause.
As I said at the start, endocrinology is a very difficult side of medicine. I hated it because it was so difficult. However, here we have 3 endocrinologists, and this has been our first one today, Dr. Priya Porn. Thank you very much for being on the program, and we'll let you go back to seeing your patients.
Okay, you're welcome. Goodbye.
The second of our 3 endocrinologists is with us, and this is Dr. Kansari. Welcome to the program, Dr. Kansari.
Good afternoon, Ka.
There are a number of endocrine glands in the human body, and these are mainly ones that are ductless. They don't have a tube leading somewhere else, but they actually secrete the hormones into the bloodstream directly.
Yes.
Correct? Right. How about telling us a little bit about the thyroid gland, because that's something that has been in the news in Asia for many, many years, related in some ways to a lack of iodine in the diet of children in Southeast Asia. But tell us more about the thyroid, where it is and what it does.
Okay, thyroid gland, okay, is the gland that produce thyroid hormones, okay. It's lying around our neck area. It's like a butterfly shape. And the thyroid gland is a hormone for metabolism. It controls all of metabolism, feeling active, feeling hot or cold, and it's related to your our weight. So endocrine gland, it means the gland that produce hormones, okay, that secrete at local area, but it can act in every organs. Okay, so the thyroid gland is also. So that's the thyroid incidence of thyroid disease around the world is it's very common. Okay, it's common all over the world. Okay, we have many patients that have thyroid disease, but it's different in type. Okay, the one that you said that is iodine deficiency. Okay, it's called the thyroid disease called goiter. Goiter is in the past. Okay, the incidence was more, but now because in almost area of the world, okay, it's the area that's lack of iodine is less. So that's why the goiter, the incidence of goiter is less. But the other problem for thyroid gland like thyrotoxicosis, hypothyroid disease causes from immune system. Okay, it still exists, very common.
So thyroid, and you mentioned the condition called goiter. That's when it's enlarged, and it should be fairly easy for the patient to see that there is something wrong and come and see you. What about with thyroid deficiency? What symptoms would the patient have?
Okay. About thyroid deficiency, that we call hypothyroidism in medical term. The symptoms, the signs and the symptoms of hypothyroidism is dry skin, dry and coarse of your hair. Some cases get loss of eyebrow, and your weight can be gained a lot. Because of the less metabolism, you eat less, but wow, why you gain weight? And other symptoms is look like the edema. Edema is a swelling of your face, of your hands and feet, and you can feel more sleepy in daytime, even though you sleep enough in the night. So that's if someone get the symptoms like this, even though you have no enlargement of thyroid glands, you should see doctor to check your thyroid function test.
Thank you very much. Now, another endocrine gland, and one that most men don't imagine is a gland, and that's the testes. Now, they secrete hormones. Would you like to tell us a bit about that?
Okay, this is a sex hormone we call testosterone. Okay, it's produced by testes and stimulated directly from adrenal. About testosterone, okay, the organ that produces testosterone has many, okay, in the adrenal gland, okay, and also in testes. So it's a sex hormone, yes, of course, for male, for men, but it's needed for lifelong in men. It's not like the sex hormone for women, because women needs a sex hormone like estrogen, okay, until they get 50 years old only. But in men, it's not like that, okay. You can use testosterone lifelong. So that's why when men, some patients, okay, get testosterone deficiency, so it can cause many problems with them.
And of course, gentlemen, the answer to testosterone deficiency is not blue diamonds. Now, Dr. Kansari, thank you very much for being on the program and telling us a little bit about some of the endocrine disorders. Endocrinology, as I said, is an enormous span because it covers the entire body. Because we're looking at hormones here. So thank you again very much indeed. Now, I know I did promise you 3 endocrinologists, but unfortunately our third lady, Dr. Mayura, has been called away. So Dr. Priyaporn and Dr. Kansari are the 2 that you've seen, and endocrinology in our wonderful new endocrinology centre is, as I said, an important part of medicine. It's not like surgery where you know what you're going to do and you go in and you cut it off or you cut it out. Endocrinology affects all the organs in the body, and one endocrine gland can affect 2 or 3 other endocrine glands. So it becomes very difficult for the endocrinologist to know which gland do I treat first. A very tricky subject, and that's why I didn't like it. This is Dr. Ian saying we've had our opening of our new endocrinology centre, and if you need us, we're there. We're the only centre on the Eastern Seaboard with 3 endocrinologists in the staff, so we've got somebody who can look after you. This is Dr. Ian saying, see you next time.